Hey YouTube, this is Mia. So sorry I'm getting this to y'all so late. I'm recording to you from my closet. You can't see, yeah, from the shoes up there. Anyway, I had my first visit with the doctor, Dr. Pilcher, with Methodist Specialty and Transplant Hospital here in San Antonio, Texas. And let me tell you, it was an event. First off, it was an all-day thing. I got there at 8:30 a.m. I didn't leave till 4. I met with the psychiatrist, the nutritionist, the patient advocate, the doctor himself, and the insurance specialist. With my insurance for the surgery, my out-of-pocket is going to be about $780, which is really good considering it's a $7,000 procedure, or $8,000 procedure. So I'm feeling pretty good about that. Feeling pretty well with that. I do have to still pay for the anesthesia and for the facility, depending on what my insurance will cover for that. But, I've saved up money for this, so I'm ready to make that move. So, kind of getting that estimate was really good. Now, about the doctor. I am so in love with my doctor. I'm so serious. He's about 5'3", but he's the most handsome thing on the planet, I swear. Anyway, I'm gonna like name my firstborn son after him or something, just to just to remember. No, I don't know. I'm just joking. Anyway, so we went over a lot of the things, and I'm a really good candidate is what he says. One thing that did kind of, I guess, upset me is that my blood pressure was high yesterday. As I said before, I'm on 3 different medicines right now currently, and it was still high. Kind of really upset me. Anyway, I do have a bunch of x-rays. They want to check out my kidneys. Because since my blood pressure's been so high for so long, they want to make sure that everything's okay with that. And I have a couple other health things to deal with. But other than that, it was a pretty good thing. I don't really like my nutritionist. I'm just going to go out and say it. She was a little snappy, but she was a little skinny little thing, so I just kind of thought that maybe she was hungry and that's why she was ornery. But, but no, it was a pretty cool facility. Have a very good setup. Generally speaking, they're very nice. They're very nice people. And we're shooting for. Unfortunately, even though I have been on a diet with my general practitioner for the past year or so, since we didn't document it correctly, it doesn't really count according to my insurance. So, the good news is, well, the bad news is I have to wait. The good news is that since I did start my surgical weight loss thing or whatever with my previous surgeon, Dr. Wright, they're counting that. So instead of having a 6-month wait like my insurance usually requires, I only have 4 more months left. So about August or so, we may be seeing some cutting going on. So I'm kind of bummed that I have to wait so long, but I will do what I have to do in order to get this surgery underway. But I'll tell you, I'm so excited about it. Everything looks a go from the medical perspective. I just have to get those x-rays done. I got all my labs done, so we'll see how that goes. One scary thing though is that lately I've been feeling really sick. On Monday I had the worst headache I thought I'd ever had in my entire life. It was centered right behind my eyeballs. I really wanted to just scoop my eyes out with a spoon or something. Like, it was the most horrible thing on the planet, and it really just came out of nowhere. Just all of a sudden, it was like blinding pain, you know, right behind my eyes, and I was nauseated, and my nose started to bleed, and it was horrible. And ibuprofen didn't really help. Tylenol didn't really help. I eventually just put a cloth over my face and went to sleep. But I've had that headache with me for the past week. You know, today is officially Friday, and my head has been killing me still. It's not as bad as what it was on Monday. I can at least stand to be in the light, but before that, God, it was horrible. And today, which was kind of scary, is that I started developing tremors in my hands. I went to I was eating lunch, and I had eaten before that day, so I don't really think that my blood sugar was low, you know, and according to my labs, you know, at my fasting, after fasting, my blood pressure is still in the, not my blood pressure, my blood glucose is still at a pretty normal range, so, I mean, I might be hyperglycemic, you know, I mean, you never know, but I sat down to eat, and I couldn't hold my fork. My hands were just shaking, jerky movements. I went to grab my cup, and the water was sloshing over the sides of the cup because my hands were shaking so badly. And you know, I was trying to eat soup, and the soup was sloshing all over the table. Anyway, it was a really scary experience, so I'm gonna go to the doctor and see what that could be. Maybe it's stress related, maybe it's one of the medications I'm taking. I mean, I've researched the side effects of the medicines. None of them really indicate that, but you never know. I'm not a doctor. I didn't go to medical school, so yeah, I'll go ahead and defer to them on that issue. But I'll let you know what the doctor says. I really want to make sure that all of my health issues are squared away before I go and have the surgery in August. But other than that, there's nothing new going on in my life. So yeah, I'm going to cut this video short. So sorry it took me so long to get to you guys. Thanks to all my new subscribers. Thanks especially to people who have personally messaged me. I really appreciate that insight and the advice that you offered, and really the YouTube community is very supportive, and I really think that this is a great tool and resource for a lot of people that are trying to not just even for weight loss surgery, you know, just to get out there. Anyway, so I'm gonna cut it short here and get out of my closet, I guess. And I think that I will talk to you guys maybe next week. We'll see. I'll keep you guys posted. Alright, bye.